First of all, we want our fellows to get a lot of hands-on experience with everything medical retina. And I have 8 wonderful retina colleagues, both medical and surgical, that our fellows will learn from. Additionally, a thing that's very unique to our program is that we have the Inherited Retinal Degenerations Clinic. So there'll be a lot of exposure to patients who have these diseases, and our fellows will participate in both their diagnosis and a lot of the clinical trials that are associated with those patients. We will also have a lot of exposure to a lot of the other retinal clinical trials that we do here. We're very lucky in that we participate in several of those, including the DRCR-NET trials. And we do also have a large presence in ocular imaging research. So we're very hopeful that our fellow, given interest, will be interested in participating in some of those clinical trials too.
Uveitis is an uncommon condition in the eyes, and we need to have more trainees that have familiarity with a lot of the new therapeutics that are coming onto the market for uveitis. Traditionally, we've used systemic immunosuppressive agents that have been adapted from rheumatology to treat inflammatory eye conditions, but there's more and more interest in actually doing clinical trial work of these agents in uveitis itself, as well as we need more people to look into how we can use these new biologic agents that are more site-targeted against inflammatory eye conditions. And so we need trainees that are interested in learning about this approach to caring for eyes that's a little more systemic in nature.
I'm just very excited that, in addition to the medical retina training, you will have a unique exposure to inherited retinal degenerations and to uveitis, things that are so important in the care of patients with retinal diseases.
I'm really excited with having a new fellow to help us expand some of our research. It's a busy clinical practice, and I feel like fellows really bring a lot to the table with being able to take ideas that we get from our clinical practice and move them into not just an idea, but maybe a study we can do, a paper we can write, even moving things from the lab setting. And I really hope that by having a fellow, we're going to be able to get to do more of that work here.
We have a very unique family feel to our fellowship, which I think is very important, and a lot of research exposure in addition to a lot of the good clinical exposure. So basically, it's all the fun things about retina, and we hope to give you a good exposure to all those different types of it.
I'm a Wisconsin native. I actually went to college in Madison, and I then was away for my training and then some practice for a number of years. And I could definitely say it's like coming back home being here at the university again. And so I hope that we can have some fellows join us and it can be part of their home eventually as well.